everybody, welcome back to Essential Oils, and today we are beginning Module 2. And in Module 2 we're going to cover methods of use, we're going to cover carrier oils, we'll touch on storage, and then we're going to talk about suppliers and how to choose a supplier that you like. So we'll jump right in with methods of use. So we briefly covered in our basics and definition section the real basics of like neat or dilution and formula versus single oil. So once you make those really basic decisions, then you need to decide how you or your patient is going to use the oil and apply them and get them into their body and working for them. Inhalation, really obvious first way, and a way that we experience essential oils. Basically, however you use them, inhalation is going to be part of that because you're going to smell them. They have an odor. So whether you use them topically or in the bath or any of the other ways that we talk about it, inhalation is going to be a component of that, but then there's also just straight inhalation and using the oils that way, and there are a number of different ways to do that. One really convenient, excellent way to do that is with these really great little essential oil inhalers. And so you just unscrew the top, there's a little hole or series of holes, and then you hold them up to the nostrils and inhale, and inside of that there's this cotton wick that you just, you drop the essential oil formula or single or however you're going to do it. Typically you're going to put neat oils onto one of these for inhalation, and then that gets inserted into the bottom of the inhaler and locked in place, and then you open it and use it. You can throw it in your pocket, you can have it in your bag, really easy to carry around. That's something that's wonderful to use for a number of things, something where you want that immediate relief on the spot. Could be for, helping to keep your sinuses open. That's a typical way that these have been around for years, and now they're more widely used with essential oil practitioners for other things too. But you could keep it in your bag, and if you feel anxiety coming on, you've got something right there, or you want to increase your focus for taking a test or studying, or all different reasons, all different ways to use these convenient little wonderful essential oil inhalers. And then another really good way to get to do inhalation is steam inhalation, and you can do steam inhalation just for for one individual person. So what you're going to do is you're going to have either, maybe 2 or 3 neat undiluted oils that you're going to use, or 2 or 3 drops of an undiluted formula that you've already created and blended. You're going to get a mug, just a regular mug of hot water that's hot enough to be steaming, and you're going to get a towel, and you're going to get a little plate, a little saucer or something, anything to put over the top of your mug and keep that steam from coming out. So you've got your hot mug, the steam is coming out, you're going to put in 2 to 3 drops of your oils, your oil blend, pop that plate on top so that you're not losing any of that wonderful essential oil steam. Take a towel, cover your head and the mug, pull the plate off, take a couple of deep breaths to inhale that steam. Remember, we talked about heat increasing the absorption rate and activity rate of essential oils. So you take these nice deep breaths in of that oil, put the plate back on, take a couple of regular breaths, give yourself a break, and continue doing that for a minute or 2 minutes, and that can be amazing. If you have a cold, that's great to take a great like wind cold or wind heat invasion formula and do that. And there's going to be a lot of top note oils. You can do that frequently. It feels really good. It helps resolve the condition quickly. So that's a type of personal inhalation. that can be used, that's a little bit more, because you do have that heat component, that's going to act a little bit more quickly and maybe a little bit more effectively than the inhaler that's super convenient to bring around with you. But if you're at home, you can give yourself a little bit more effective treatment by doing that steam inhalation, that individualized steam inhalation with the mug and the hot water. And then diffusion is another type of inhalation. Diffusion's become really popular. And in Chinese medicine, thinking diffusion is a little bit controversial. And not because there's anything wrong with it or it's dangerous or anything like that, but because Chinese medicine is so individualized and diffusion treats everybody in the space. So if you're diffusing in your house because of a condition that you personally have, everybody in your house is getting that same treatment. It really might not be appropriate for them. So, if you're treating a shared space with diffusion, that's really important to think about. And maybe, some of the ways that can be really great is that, like, if there's a cold going around or a bug going around, you could use a formula that might help fight that off and help keep that from spreading. But I know, that doesn't work for everybody too. So you have to, if your family's amenable to that and everybody's on board with it, that's great. But doing that in more of a shared space, like your clinic or a classroom or something like that, it will be not uncommon at all for you to have somebody not enjoy that experience and not enjoy those oils. So that is something to think about with diffusion. That said, if there's somebody who's really sick and might need their space treated in that way, close the door and do it in their room. Or like I said, if you're trying to prevent the spreading of something. But again, you would want to know how people feel about that. And there's a wide range of diffusers, from diffusers that use heat to diffusers that use water to diffusers that use neither heat nor water. So if diffusing is something that you're interested in, I would first think about the aspect of treating everybody that shares the space and the consequences of that. But then also do your research and pick a diffuser that you like how it works and feels like a good product to you. I've had frustrating luck with the ones that use water. They tend to break down quickly, but I know there are people who love them. And then this is another really simple type of diffuser. I'm trying to get myself out of this so you can see it a little better. So there's an opening in here in which a tea candle rests. You light the tea candle in the top. This is well used. You put some water and then drop the essential oils into the water. The tea candle is enough to heat that water enough to create some steam and diffuse that essential oil or essential oil blend out into the space. And there's some really pretty little candle ones like that. There's also ones you can set on top of a light bulb. Lots of options for diffusing. And then we can talk about baths and using essential oils in baths. One really important caution with using essential oils in the bath is that you have to check and double check whether the oils that you're using are photosensitive, because photosensitive oils will have the potential to burn the skin when heat is added, and that can be a disaster when it's your whole body, because a bath is treating your whole body with the oil. So if you or yourself or your child or a patient gets into a bath that has essential oils in it that are going to be very irritating to their skin, all of a sudden their whole body is going to be really irritated. So really keep an eye on what oils you're using. And I had personal experience with this, with treating cold bee in myself and my hip, and it was just so deep, and it was winter, and it was so in there, and I thought that a clove and ginger would just feel amazing. And I knew that there was going to be a photosensitive issue, and I knew that it was going to irritate my skin a little bit, but I was desperate and really wanted that relief. And so I did a blend with those and with the bath salts and did a bath, and I have to say it did irritate my skin. It was very burny and very prickly on my skin, but man, did it work. Like, oh my gosh, it felt amazing, and it lasted. I mean, it lasted a really long time. It really resolved it for a while, but I would never send a patient home with that blend knowing the irritation. But it's good, it's good to get your own personal experience with these things and know what it feels like to have a reaction like that. And sometimes things are appropriate that you wouldn't normally do. But you might try on yourself. I don't know, but use caution. That's my main point here. Use caution. Double check whether an oil is photosensitive or is a really hot oil before you use it in the bath, especially with children. Okay, but that said, thinking about baths, so what you want to do with a bath is create a hypertonic solution, and to avoid pulling moisture out of your body. So if you take a salt bath that doesn't have enough salt, you're drawing moisture out of your body. If you take a bath with a lot of salt, it's actually maintaining the moisture in your body, maybe even adding moisture, or water. So you want to create a hypertonic solution, and that takes 1 to 2 cups of salt for your typical bathtub, and how depending on how full you fill your bath. And so you can use nice sea salt. This is a fine ground sea salt. This is expensive. I probably wouldn't use this for a bath just because this is like it's probably like a $10 or $15 bag of salt, and you're not going to get that much in it. You can use this for smelling salts though, going kind of back to inhalation. Use these fine salts are good for that, but you can use, I was just sort of using this as an example, that you can just use the basic sea salt for a bath, or you can use Epsom salt, you can use magnesium salt. So this is a magnesium salt made from the Dead Sea salts, and this is actually it's not a local product because it comes from the Dead Sea, but it's processed and packaged here in, I think, Garden, Tryon, from Tryon. But this is a neat company, and it's priced accordingly to where you can use a cup or 2 of this and take a great bath with it. So you're going to take a cup or 2 of your salt, put it into a bowl, and add to that much. You can add, and depending on how the formula you're using and how sensitive your skin is, you can add to 1 to 2 cups of salt, anywhere from 15 to like 40 drops of essential oil neat. So it takes a lot. It does take quite a bit of essential oil. It would take a lot of a formula that you create to do baths. So you can kind of keep that in the ballpark of like 5 to 10 drops of each oil that you're going to use, considering that you're going to use between 3 and 5 oils in your blend for the bath. And baths are really effective. They are, but they need to be done frequently, which uses a lot of oil, uses a lot of water, takes quite a bit of time. So that's just something to keep in mind when you're considering a bath. You can have good success with 1 to 2 baths depending on what it is, and sometimes just the experience of that self-care experience of somebody taking a couple of baths can really be worth its weight right there. And then we're not going to talk much at all about internal use. That's really not within the scope of this course. But if you are going to consider using essential oils internally, I'll just put this out there for safety's sake. They need to be emulsified before they are ingested. Emulsification can happen with honey, it can happen with salt, it can happen with vinegar, it can happen with aloe. So these are some various things that you can emulsify in oil, and basically what that means is you're going to mix that oil with like your oils, which if you're doing internally, you're not going to want to be doing more than like a drop or 2, maybe 3. So you're going to take a teaspoon of one of those emulsifiers that I just mentioned, put the essential oil into that and mix it very well. mix it very well. So like think of making a salad dressing, basic salad dressing, you have oil, you have vinegar. At first, they're not mixing. And then if you shake, you start to get a uniform blend where emulsification is happening. And you want that to happen before you ingest essential oil so that it doesn't burn your mucous membranes, burn your stomach lining, and it'll be more easily absorbed into your body. So we can talk a little bit more about that in person. Some of the companies that are sort of pushing internal use a little bit more, and just kind of give you some ideas to help you guide your thinking on how and if you want to use essential oils internally. But like I said, it's not really a part of the scope of this class. I'm just throwing that in there as a caution, as a safety, that you want to make sure that they're emulsified. And also for this next step, another method of use is gargling. And for gargling, you're also going to want to emulsify the oil first. So again, to gargle, I typically use salt. So I'll put a little bit of salt in a cup, add the essential oils, mix them together very well, then add warm water, then do the swish or the gargle for 30 seconds or so. So it's like 1 to 3 drops of neat essential oil or neat essential oil formula into a half a teaspoon of salt or something, and then add a couple ounces of warm water and swish or gargle. 20, 30 seconds up to a minute or so, depending on what you're working with. And you can do that like 2 or 4 times a day. It can be great for sore throat. It can be great for a tooth infection, a gum infection, canker sores, various local things that are local to the mouth. And same goes for the neti pot. You're going to do, this is a neti pot. That's a nasal wash pot. And you're going to want to do that similar emulsification for a neti pot, usually with the salt, if you're going to use essential oils in your neti pot. And then topically, of course, and there's various ways to use essential oils topically. So I use these really frequently. This is a little roller. Got a metal roller in the top, dark glass bottle. You put your formula in there with a carrier oil, and then tell the person where you want them to use it. And you don't have to use a ton, just that's fine. You don't want to be painting it onto your body and getting all kinds, just a little bit, like equivalent of 1 to 3 drops of essential oil. As we go through case studies and as we talk in class, we'll talk about how you decide on different areas of the body where you want the person to apply their essential oils. But this is a really great topical way of getting a dilution on. Very convenient, nice and secure. This is another really common way, and I'll bring in a bunch of bottles and stuff when we meet in person, and we can look at them and all the different sizes and the ranges and everything. But this is another dropper bottle, really common way to use essential oils topically. Again, just a couple of drops, doesn't take much. Handy dandy dropper bottle. So with using them topically, you can use them like those bottles do, those little products do. It's use them diluted on an area of the body, like apply morning and evening to your chest and low belly. And then, or you can do it locally to an issue that they're having, say over a scar or over or near a shingles outbreak, or over an arthritic knee. So lots of different ways to decide where you're going to use something locally. And so there's also salves. You might want to get really into that. Salves are super fun to make, and they're really not that hard, but that's another great way to use essential oils topically. And then you can also use the oils, and we will talk about this when we meet in person a little bit more, is to use them neat on acupuncture points. And this is something I do a lot in my practice, really for patients that don't want needles or can't tolerate needles, or for some reason or other they're not interested in having acupuncture, I do essential oil treatments on acupuncture points. And when you do this, we'll talk, like I said, we'll talk more about this in person, but instead of creating a formula and then putting it on acupuncture points, I put individual neat oils on acupuncture points. And same thing, I may use 3 to 5 oils per treatment, but I'm not actually mixing those oils together. So, maybe I'll put rose on Ren 17 and fir on kidney 6, so I'm kind of doing it that way. And some of the acupuncture points that are really great choices for use with essential oils are ones that have yuan qi connection, so source points, mu points, shu points, low points, wind gates, calm spirit points, regulate qi points. So you're going to think about the point that you're using in relation to the oil that you're using. So that's a little bit different too. With acupuncture, you choose the point you're using, and then you needle all those points. You might change your needles up a little bit, but you're putting a needle at all of those points. And with using essential oils on acupuncture points, you want to find a point that's going to resonate with the oil that you're choosing. So you want to match your points with your oils. And as I'm looking over here, is one more thing I see for diffusion or inhalation is a little spray bottle. You can't find the lens there. So this is an example of a little essential oil blend. So it's witch hazel in the bottle with a little bit of water, and then in here there are 4 essential oils. Shake it up, spray it out, gives a really fine mist. And these can be used on bed linen before someone goes to sleep. You can do it in the room, you can do it in your car, but that's another way of, and that's a little bit, it's a diffusion, but it's a little bit less diffuse than using a diffuser. It keeps things a little bit more local around the person. So that's another option too. So the room or linen spray, or just a sort of space spray. And then of course, along with methods of use, becomes frequency of use is also something that's going to be considered. And as we do case studies, we'll talk more about that. But whether you want to be using it 5 times a day, once a day, for 3 days, for a week, for 6 months, those are all things that you need to consider and discuss with your patient when you discuss whether or not they're interested in using essential oils, to make sure that their compliance will be there. And then in considering ways of use, inhalation resonates a lot with the Wei Qi. Breathing it in, it's going to your lungs, you're having immediate interaction with it, it's immediate sensory interaction with it, it's going right to your brain. So inhalation really resonates with Wei Qi. Neat on source points and on points that resonate with Yuan Qi, that resonates with Yuan Qi. Ying Qi, again, that's going to be your point choice, maybe points that regulate blood, or area where you're doing application could be considered, but also internally, using them internally resonates with Ying Qi, the nutritive Qi. And you're never going to use an oil or blend continuously. We talked about this a little bit before, but your body will sensitize to it. So if someone's got an acute condition, you're wanting to see that resolve quickly, they may use it daily for a week to a month to help that condition resolve, depending on what it is. And a chronic condition, something that they've really had for quite a while, they might use it daily for up to 3 weeks. And if they're going to continue to use it after that, then you're going to want to put it into rotation to where it's not happening every day. So a really common rotation with essential oils is 3 days on, 3 days off. And that's kind of a Yuan Qi rhythm. And the oils resonate with Yuan Qi. I find people are compliant with that for a while. And then keeping track of whether it's been 1 day or 2 days or 3 days since they've used the oils or that they've been using the oils starts to get a little muddled for them. If I really am wanting a deep, strong Yuan Qi resonance, I'll encourage them to, enter it into their calendar or, have a way of keeping track of it, keep a little log or something. If it's more that I want them on the blend longer term, I might say don't use it on the weekends. So, Monday through Friday and then take a break on the weekend. So again, you're creating a pattern, you're avoiding sensitization, but that might be a little bit easier for them to comply with. So that is methods of use. And as always, if you have any questions, please email me and I'll try to get back to you as quickly as I can. And also feel free to jot down questions to go over in person, when we meet as a class. I can't wait to meet you guys. And then, we'll wrap methods of use up with that. And next we're going to still be in module 2, and we're going to talk about carrier oils.